was that we must continue and should probably focus a bit more on whether the organisation is a learning organisation. So that really, we felt, makes a difference to how adaptable and patient-centred an organisation is. The second point we talked about was around co-visits and sharing information with our system partners or anybody else who we feel may be able to give us a real sense of what's happening in services. And making sure that co-working and sharing of information is timely and quick, so that we can continue to get the most current perspective on the service. And the last point from that question was around the supportive relationship that's been delivered, a bit more supportive relationship that's been delivered over the last sort of 6 to 9 months during COVID. But the fundamental thing around that was around the relationship. So the ability for services to form a relationship with CQC workers and really get that ongoing understanding, less duplication, less short, sharp, big inspection, but much more of a continual opinion on what's happening with services. The second question we focused on was around evolving the ratings to make sure they're fit for purpose. And two key things from here really was around the broad nature of many of our ratings characteristics and how you can have a very different service if you pick up 2 reports that are rated good. So whether we can be a bit more nuanced in how we assign a rating and the information and the content and the rationale behind that to give a clear understanding to the public whether something is very good, for instance, or not so good, but certainly not requires improvement or outstanding. And then the second bit was around this very strong opinion that we must continue to cross the threshold. So some powerful reflections from members who have continued with remote working for us over the pandemic and how it's been very beneficial in many ways, but actually to be in a service and to feel and see what's happening, we must continue to do that. And then just a final point really was about whether we could make our public telephone lines and email forms, etc., a bit more accessible, friendly, and confirming anonymity of people, because many people find it very difficult to raise concerns with us and be clear about what they are without fear for either their relative or if they're an employee around whistleblowing. So those were our 3 points for that.
Fantastic. Thanks ever so much, Helen. Sounds like a great discussion in the room. If we move on to room 2 now, Harriet and Abigail, would be great to hear from you guys.
Hi, it's me, Harriet. I'm going to feed back on the behalf of the group. So the first question, we started off with the same one as Helen's group. And we thought it was really important to focus on the outcomes for the people who use the services. That includes things like how the service has been working together with their PPG. It should also include positive aspects as well, not just focusing on the negative. We also talked about whether there's too much focus on safe and CQC inspections. Quite a lot of that could be gathered remotely, and CQC should be focusing more on, for example, evidence of continual improvement and ensuring that those outcomes are good for people who use services. Another area we talked about was the importance of looking at people's journey from the beginning of the service, and also whether they can actually access it or how well they can access it in the first place. And then we started looking at the question of ratings. There was a good question about how much does CQC know about how they are used and valued by the public. Do we need to actually change the way in which we decide ratings, so use a different framework? And there was also a point in that about the burden on providers of more frequent inspection or engagement. That is going to take up more time. Even if it's small engagement, it is still taking up more of their time, because you would want to be prepared if you're engaging with a CQC inspector.
Fantastic, Harriet. Thank you so much. Great points there. If we move on to group 3, which are Angela and Jen, Great to hear
Hello.
from you guys. Hi.
Hiya, I'm Angela. I'm just feeding back on behalf of our group. So yeah, so we looked at questions 1 and 2, and then we did have some time to move on to question 3, and we talked about the sharing of information between not just provider organisations, but also to represent people. And we just talked about the fact that we need to be careful around the digital concept. We also talked about the inspections and the time scales in between them taking place, and it was felt like they were too long and they need to be shorter, and we need more defined timescales. And we also talked about utilising people with lay experience better as well. And that was our 3 points.
Fantastic. Thanks ever so much, Angela. Great to hear from you guys. Feel a bit like Eurovision at this bit. If we head over to room 4 now, which I think is Sarah and Jill. Great to hear from you guys.
Hello. So we were a provider-only room. So we started on question 3. So I'll focus our points, feedback points are kind of around that really. So the first one was the importance of understanding the information that we want and who provides it. So we need a baseline, and there was a suggestion of being clear on who the authoritative voice on a particular issue was, so that providers could kind of share wants through that voice, and then partners would get the information from them. And that might also help kind of show up any gaps as well where that doesn't exist. Second point, and more generally, there was a general welcome move to a more real-time view, and the conversation went, we talked about sharing the continuing improvement, and kind of some of the points around outstanding providers, in particular, who might not have inspections as frequently as other providers, for them being able to show how they are still either trying to maintain outstanding or continually innovate, which is helpful for other providers to learn from them, as well as people using services being able to see what that provider is doing. And of course, for other providers in the time between their inspections, being able to show what they're doing to improve in their service. And then the final point was a bit of a note of caution really around us needing to maintain our role as a regulator and being really clear in that. So, you know, if we're having more access to real-time data, for example, we shouldn't overstep the mark, and we don't want to become a provider, and it would be helpful if we could be open around any thresholds that might trigger activity, and I suppose be mindful about the additional pressures that it might unwittingly put on providers if they feel like we're always, I suppose, checking in on them, and kind of being mindful of that. And that might come into some of the other strategy areas around the relationships that we have with providers, where that might be addressed. And of course, if there's a change to how we're looking at data, there's an impact on providers' governance approaches. So the more open and transparent we can be, the better.
Fantastic. Thanks, Sarah. Great points. And finally, group 5 with Sam and Ellen.
Hi, everyone. It's Sam here. So we started looking at question 3, so the question about data and information collection. So we started with an interesting suggestion about whether we could think about having almost like a central point where providers could just submit or send information to whenever it's updated or whenever it's new, and that's where CQC can access the most up-to-date information about a provider it needs, so it's not having to, you know, necessarily send loads of information requests throughout the year. There's just a kind of a one place to go to. We also had a conversation about how our approach might need to be different for different sectors. And I think in particular, we were thinking around independent providers, where there are a lot less organisations already in the space of collecting information. So you don't have, you know, NHS England, for example, really involved in this space for health providers. And we might need to think about doing something different. We might need to do more in that area ourselves. And kind of got into a conversation about how that might impact on our inspection regimes might need to be different, because if there's less information being collected or in our whole system, would that mean we might need to inspect more or less in a particular sector because of that? We then also talked about kind of sharing of information between organisations, and one of the concerns that was raised is that organisations do different things with the information they collect. So is CQC collecting the raw data a provider has submitted, or are they collecting whatever that organisation has done to it and transformed it into? And does that mean that it's as useful, less useful? Will it give the complete picture? So a bit of word of caution around that. And then we talked about how the important work CQC needs to do to get together with other regulators and other people who collect information to present a single unified view to providers about what is it they need to share with the system as a whole, and this is how they're going to do it, so that providers aren't confused, they're not thinking there's all these different people they've got to share the same information with, etc. We then went on to question 2, which was looking at ratings. And we talked about a few different things here. We talked about the importance of ratings being accurate and up to date. And we talked about how sometimes some of the aggregation rules we have can be a barrier to that, especially if we're only doing focused inspections on one particular core service or looking at one particular key question. If that changes, how does that impact the overall rating? Or if one doesn't change, but all the others have, does the overall rating stay reflective of the quality provided? So quite a few issues there. We thought one of the things that can kind of mitigate that, but we don't currently get right, is the information we share alongside a rating. So currently that's primarily the inspection report, but we talked about whether that needs to get a lot better. So a member of the public or a commissioner or someone else who relies on that rating to make a decision about a provider, when they come to that rating, they can understand what it actually means at that point in time. Is it our view that the overall rating of requires improvement is actually accurate, or are there some things around that that someone needs to understand before making a decision? We had a few dental stakeholders in the room, so we talked about ratings for dental providers. That's of course one of the sectors we don't currently rate. So I think the kind of main concern there is that our inspection frequencies, which are around inspecting 10% per year, probably aren't adequate to be able to start to rate or present a kind of accurate view of ratings across the sector. So if we were ever to move in that direction in the future, we would need to seriously look at that part of things. And then finally, we didn't really have time to cover question 1, but one of the things people wanted to flag from the room was that the issue of access is a big issue at the moment, and potentially will be a big issue in the future as well. So that's one of the things we need to think about.
Fantastic. Sam, thank you so much for feeding back on behalf of Group 5, and just an enormous thank you to everybody involved today for such diverse and interesting conversations. As kind of the lead for smarter regulation, I can't tell you how valuable these sorts of sessions are at informing our thinking. If we could move on to the next slide, please. So we're 3 minutes to spare. I just want to sort of wrap up for the day. Like I say, enormous thank you for joining this. I know how busy everybody is, particularly at the moment, so I can't tell you how grateful we are for you all taking the time out of your days to come and have these conversations with us. Please continue to get involved, both in this theme and other themes, if they tickle your fancy. Lots of ways to do that, either through Citizen Lab, future events that we're holding, as well as the formal consultation engagement, which will be happening after Christmas in the new year. Please do continue these conversations with us. There's a great opportunity here to shape the future. We really want to work with you on that. I think Steph is hopefully popping in the chat a bit of a link to a feedback form. We would love to hear from you. How have you found today? Could we make it better for future sessions? We want to continue to evolve this. So once again, huge thanks, as well as thanks to my CQC colleagues who facilitated the rooms. Really, really grateful to you guys, and look forward to seeing the detailed notes to help feed into the next iterations and future implementation work. But on behalf of everybody at CQC, including myself and Chris, thank you so much for taking the time to join us, and stay safe, and look forward to seeing you all soon. Thanks ever so much.